All right. I'm so excited to introduce our Direction Not Perfection community today to Dr. Sara Tariq. Before joining her current practice, she spent over 20 years caring for patients and mentoring future doctors. At the University of Arkansas for Medical Sciences, she held leadership roles where she taught thousands of physicians and the importance of building trust and connection with their patients. And with over this 2 decades of experience in internal medicine, I feel like Dr. Tarek at this point knows what she's fighting for, helping patients feel their best, build genuine connections, focusing on preventing illnesses, supporting chronic conditions, with honestly this care that's tailored to each individual person, which is huge. And her ultimate goal is to have every patient take charge of their own health with confidence. And I love this. This should be our podcast title because I don't think very many of us can confidently say that we have that in our health journey. So, welcome, Dr. Tariq.
Thank you so much. It's lovely being here.
So excited to have you. And again, you've kind of had a journey here. And if you want to take us through a little bit of your journey and how you got to your current practice, I always think it's fun to be brought along.
Sure. As you mentioned, I've been in academia most of my life, 22 years. Worked at the University of Arkansas for Medical Sciences, teaching, seeing patients, moved up in administration, became a student affairs dean, and continued my private practice as well. Moved to the Northern Virginia, DC area purely for family reasons, and was really fortunate to find this job at Northern Virginia Family Practice, where I found that for the first time in my life, I was able to practice medicine in the way that I really felt was important and meaningful, which means I'm able to give the time to my patients that they need. And if that means I need to see them every 2 weeks, then I'll see them every 2 weeks. And there's space for silence, there's space for depth, there's space for understanding. And I absolutely just love that.
I think any listener that just heard this out of your mouth is going, how do I get that? Holy cow. I can't imagine having that kind of time with my physician and being heard. How many times do you hear that out of your patients? Just like, thank you for listening.
I'm very grateful. I hear it quite a bit.
I'm sure it does take time and depth. I like that you said that. So, I would love to bring you into this space with our listeners and my community. I do feel like we're a little niched into this weight management piece. So, we'd love to pick your brain.
Sure.
And I just had some curiosity. I love you use this word, and so do I, sustainable weight management. And I was kind of curious if you had a soapbox that you stand on or any just strong beliefs around that sustainable versus quick fix type of talk.
Absolutely. I see a lot of women around the menopausal age, but I think this mantra applies to everybody, which is really, as you all know, and as your listeners know, we all have a projector in the back of our brain that gives us an image of what we think we should look like. And I really work hard to explore different ways in which people fall into that trap. Because if we're all thinking that we want to look like a certain actress or a certain movie star, we're going to fall short. And so my mantra has always been strong over skinny.
Mm.
Work on strong over skinny. That's really important in menopause when we start to lose our muscle mass and our bone mass, and we have osteoporotic falls and those sorts of things and fractures. But I think if we can really focus on strong over skinny, you lose weight in the process, feel stronger, you feel better. And that not only helps in terms of prevention of falls and prevention of surgeries and fractures, but I think it really helps us with our mindset. And so I think that's one thing that I really constantly try to get in my patients' minds, including my own. I mean, I'm not immune to that movie projector in the back of my head about what I want to look like. And so I think there's a struggle there.
Oh, there's absolutely. And maybe you find this too, but even within our own communities, we can get going strong on some real positive vibes and good talk around that strong over skinny. And then all it takes is somebody coming back out of that community and into regular social media or into another quick fix that's promising them something different. I just remember when I was working in my hospital setting, I needed a whole hour to undo everything that happened to them in that week to get them back in a good brain space. Do you feel that way?
Absolutely. I also do a lot of coaching. I do health coaching and executive coaching, and that is a huge part of what we do. It's making sure that the awareness that we create in the minds of our clients and patients is sustainable and one where they can really start to see themselves differently, away from shame, which I think is a huge part of how women in particular view themselves. For men, there's shame around their incomes, and for women, the data shows that there's a ton of shame around our body image. And I think that's a huge hurdle to at least explore. And it's painful, it's uncomfortable, but I think it's really important to explore that as well.
Yeah, absolutely. And I love that you mentioned the coaching piece too, as well as the physician piece. It's pulling it all together and then getting to see people time after time because we're undoing diet mentality of how many years have they been on these? It doesn't take one coaching session, it takes months, years before somebody starts to believe what we see out of them. So,
Exactly. I don't blame a lot of our patients as well. Just entering the grocery store is a setup for failure. It is hard to enter a grocery store and understand everything that you need to do or may want to do to get healthier, whether that's get healthier, whether that's lose weight, get stronger, all of those things. And so we're sort of at a disadvantage in that way too.
absolutely. You're right. It's not just social media. It's fed to us everywhere. Even within the household. If you have somebody who's speaking over you in a different way than just strong over skinny, that
Yeah.
becomes difficult. Yeah. So within your medical practice and as you're walking patients through their journey, how do you keep them focused this way? Like, what does this look like? Do you use in-body scales so you can look at muscle mass, or do you keep scales out of it? What's that look like?
So right now we're actually in the process of looking at how we're going to be examining that and changing our methodologies around that because our general consensus among the practices, yeah, the in-body scale, we need more data. We know that the BMI is not accurate or sufficient in helping our patients develop a deep understanding of where they are in terms of their health. And so that is a big movement and that's an inexpensive, straightforward measuring tool that I think all clinics should have. And we're certainly moving towards that as we have more and more patients who want to take a deep dive into weight loss. And as we as a clinic, and I think all over the country, many physicians are dealing with this as well, really expanding our use of GLP-1s and really working in a meaningful way to help people get to healthier weights, whether they're diabetic or not, whether they have heart disease or not. I think that is an important move for all of us. So we currently use BMI, but we are definitely moving towards all of those measures, looking at muscle mass, looking at percent body fat, all of those things.
I love that. And since you brought up GLPs, let's just talk about them for a second. And I do think there's almost like a responsibility with these medications to be able to see muscle mass. And I was just having this conversation today with a client that when the patient's a little younger, they have time to rebuild the muscle mass. There's a little less fear with that because we have time to play with. But when you think about some of our patients who are 60 years old plus going on these meds, and then if they lose muscle mass, go into your GLP-1 type fears as well as what you really like about them.
Sure. My biggest fears are exactly that. We are a culture where we want a quick fix. And my mantra is always the same before I put people on GLP-1s. And there's a detailed conversation that we have around that. And number one is you are at high risk for losing muscle mass. You don't want to lose your muscle mass, so you've got to have adequate protein. This is not an easy fix of just take an injection and keep going. You've got to keep working on your building muscle mass, whether that's weights, whether that's walking. That's really, really central. And the one thing that I think a lot of my patients struggle with is slow and easy is what wins the race. If you lose weight too fast, you're going to lose muscle. And you're not going to just lose it in places where it's hidden. You'll lose it on your face. You'll lose it in places where it affects your self-esteem as well. And so the key is really going slow, very, very slow. And that I worry that physicians are not informing our patients enough about that.
Yeah, I could see that. I could definitely see that. And I think that just even the pure basis of a medicine promising some weight loss, that of course the patient wants quicker weight loss. This should be quicker. And I, again, just had this conversation where somebody was disappointed they only saw 2 pounds, but they were maintaining muscle mass. I'm like, wait, hold, stop. Let's celebrate. That's amazing.
Yes,
Like
this
you're
is a
doing
win.
it. Yeah.
Or I've got a wedding coming up. I need to lose this weight. Let's think about that for a second, right? Let's think about how
Yes.
many pounds that means and how
Yeah.
much muscle mass you may lose depending on the pounds that you want to lose. So I think while GLP-1s have been a really helpful tool for a lot of people in this country to lose weight, to improve their diabetic status, to improve their hemoglobin A1C. I do worry that it's just fed into this quick fix, not sustainable. Let me just get this weight off and then I'll figure it out. Something is going to magically happen in my brain and I'll just figure it out.
Yes, and all the more important to have this team approach, which your office is amazing about. And I feel like there's a lot of other facilities out there that are finally doing the whole approach, having the support groups, having the dietitians, the physicians, therapists, all of it. So, yes,
Absolutely.
and I think the same way about surgical weight loss. When done correctly, when you have the team approach, when you have the therapy piece in there, then it's beautiful. But there are watch outs. I agree with you. Can you also just quickly, because I think one of the coolest things around these meds that I've seen in clients, that anti-inflammatory aspect, like knees all of a sudden feeling so much better. What do you see?
It's fascinating to me. GLP-1s, we're still sort of new in that area when it comes to weight loss and GLP-1s. We've been in this, 3 to 5 years in terms of just using GLP-1s to address obesity. And there's two things that are really interesting that we've found. A is all my joint pain is gone, right? I feel better. It doesn't hurt anymore. My knees feel better. My shoulders, my back feels better. So that's number one. And
Yeah.
when we looked at the literature a couple of months ago, I did a quick literature review. I haven't seen a whole lot in the literature yet that's really going into depth as to how and why that's happening. But I think it's absolutely fascinating. Number two, where we do have more literature in, is the whole idea behind addiction. So what we found is a significant percentage of patients who are on GLP-1s also all of a sudden don't have the craving for alcohol. They stop using drugs if they are using any. And I think it kind of gets back to the area of the brain that governs and regulates addiction and addictive behavior. But that addiction to food has similar neurologic neuronal pathways as the addiction that one might have to alcohol or any other drug or
Right.
smoking.
And yes, yes, I've seen this too, and it's fascinating to me. And then you think about pairing when somebody's doing such a good job of pairing the emotional eating, drinking, whatever piece, and what am I really hungry for? What am I really thirsty for? So fixing it emotionally and having the help of something like that is just, it's really cool to see some progress in those areas.
Yeah,
But
it's
again, it's
fascinating.
both, because
Yeah.
if the med goes away, have we done the mental work to Mhm.
Absolutely. I'm so glad you bring that up. You know what I see a lot? I used to work for a weight loss clinic for a short bit, is that there's a strong connection, and you know this, I'm sure, between trauma,
Mhm.
childhood trauma, not like the big T trauma, but the little T traumas of emotional neglect, having a parent divorced when you're at a young age without therapy, those sorts of things. There's a connection with market obesity and trauma. And I think that's another field that we're just now delving into.
Yes, so much there. My hope, my dream, I would love to see everybody in some form of maintenance therapy. Just use it. We could all benefit from it. Let's take away the stigma and dive in. It's
100%.
just
100%.
Yes. Oh, thank you. So this is fun. Let's keep going because this is how I view weight management, weight loss in general, especially women, perimenopausal, menopausal. It's a puzzle. We can talk GLP-1s, we can talk hormones, we can talk insulin resistance. I don't think you can leave anything out of the picture. And just since we have you today, let's keep picking your brain. Let's go hormones for a second.
Sure.
And what's some of your specific talk with clients who walk through the door?
Absolutely. There's two things that are really important. Number one, the hormonal fluctuation starts 4 to 7 years prior to menopause in some women. Menopause is 12 months cessation of periods. That's the actual definition of I'm in menopause. I haven't had a period in 12 months. Perimenopause happens way before that, and hormonal fluctuations happen way before that. And we know that the loss of estrogen leads to a cascading of events: loss of muscle mass, decrease in muscle mass, which results in fewer calories burned. When you don't have as much muscle mass, you're not going to burn calories as efficiently as you know, and fat kind of accumulates. Not only does it accumulate, it goes in parts of our body where we don't love, like centrally, and it gets redistributed. Hormonal fluctuations that occur in perimenopause and menopause alter energy homeostasis. Basically, it changes the way our energy is processed and stored. And so we end up storing more fat. And I often end up telling my patients, usually in menopause, you're probably going to gain 8 to 10 pounds. It may happen. And so let's talk about what you have in mind, depending on where you stand right now in terms of your health. What proactively do we need to do and what do we need to discuss to make sure that this doesn't happen or to mitigate those effects? And it's hard. I like to give all my patients grace. We also think that estrogen plays a role in our hunger signals.
Mm.
So, where previously our hunger signals may have turned on earlier, they may be turning on later. Well, how are you supposed to prevent that? What are you supposed to do? So
Right.
I really want to help people understand that there's no shame in this. This is a part of our life. This is a change that happens in our lives. And when we embrace health and strength, then it gets us to the right direction.
That's so good. Yes. Preach. Yes. Thank you for laying it out that way because that sets us up for this next piece of the conversation. So, if we can get ahead of it, if we can
Yes.
start to mitigate, like you're stating, what does that look like for the average woman who has the average connection with their primary or their OB, their GYN?
I want to be honest. If you want to have a meaningful conversation with your physician about weight loss, it can't be done in 15 minutes. It really can't. And that is where the role of a coach, a life coach, a health coach, a nutritionist, right, a dietitian, a physical fitness experts can be really important. And I worry that physicians right now don't have the time to do these things. And I think if you're privileged enough to have access to those things and to be able to financially invest in those kinds of people, there's no time better than the present to do that
Mhm.
because this is really hard. And we know the old fashioned, right? You can't diet your way out of exercise and you can't exercise your way out of eating whatever you want to eat. So there has to be a balance in both of those areas. I hate even saying this to patients because I can see their eyes glaze over. I'm like, you kind of have to get 150 minutes of exercise a week no matter what. Pause, let that sink in. It's really about creating the time. It's not what everyone says, I don't have difficulty making time for exercise. And I have to gently push back and say, it's about putting the time for exercise and then organizing your life around that a little bit. And that's a huge mind shift for a lot of people.
Mhm.
And I acknowledge that mind shift. I really do.
Yeah, I think it's like the reason why we have to love it or like it, not even love it. But like if you're in a mental space of your shoulders go up, you hate the idea, it's been a negative past experience when the gym is mentioned, then we better find something like pickleball or a walk with a buddy. Like there's so many different ways to get this where you can have a like love of it. It's
Yes.
because if we think about anything, that's what I need to do for the next however long of my life, really, if we want to keep healthy and traveling and living life.
Absolutely. And I'm so glad you brought that up because that's one of the first questions I ask my patients. What kind of exercise do you like? Then my next question is, so are you an extrovert or an introvert?
Yes.
Right? Because if you're an extrovert, you may really enjoy group activities, group
Mhm.
yoga, group cycling, group Zumba, and being accountable to a group can really be motivating. And oftentimes, what we also know post COVID, especially, there was a book written by Vivek Murthy, who's our former Surgeon General under President Biden, and he talks about the epidemic of loneliness.
Mhm.
And we are so isolated in our worlds that really getting us out of our comfort zone and getting to the gym or doing activity with people and getting a support group can not only have physical benefits, but can really have mental and psychological benefits too.
Oh, absolutely. Thank you for pointing that out. Yes. And as we all know, in the aging process, that community piece continues to be why people live longer. Those studies start to prove all of that as well. So thank you.
100%.
Ah,
Absolutely.
yes. So, and you brought this up. I love that you went to the coaching aspect versus even what are the first questions we ask our OBs or our primaries. And maybe it, to your point, is more about building our team around us and doing a ton of research on our own is kind of where I keep coming back to because I don't know about you, but as a dietitian, this took me like 3 years to really wrap my brain around. It took podcast guests, it took researching, and it took listening to it over and over again. And I'm like, if that's me and I live in this space, like, what are the fighting chances for somebody who's not that interested and they just need the information? I don't know. I get a little bit of like, oh, this is a rough journey.
It is hard. I think you're absolutely right. I'm in the same boat as you. I became very interested in my overall health at the age of 38, but I'm also in that world counseling people and looking at weight and blood pressure and cholesterol and blood sugars all the time. And so because I'm in that world, there is my mind shift that's really focused on health. For me, it was both my parents are diabetic. Neither of them is markedly overweight, but so that's in my future. I know I'm probably going to become diabetic, so I've got to do something stat ASAP. And that has to, no matter what I do, include exercise for sure.
Yes, which this piece also brings up the let's talk this with hormones since you started to talk estrogen. Your beliefs for the clients who are coming in and worried about bone health, worried about brain health, worried about general cardiovascular health. How do hormones play a role in that for you and your belief system?
So I am what the data shows is that for women, particularly at the onset of menopause or at the onset of perimenopause, even before, hormone replacement therapy plays a huge and significant role in many of the things that you've mentioned. We know that there's no better treatment for hot flashes, postmenopausal or perimenopausal hot flashes than hormone replacement therapy. In addition, as you mentioned, immense cardiovascular benefits, bone health benefits. It helps with our mood. There's several large papers that looked at the deep connection between menopause and depression and mood disorders, menopause and sleep. And we know that once you get under the cloud of depression, it takes a while to get out of that and you lose time, hormone replacement. And so I think hormone replacement therapy has a huge role to play in many, many of those areas. We initially were giving a lot of hormone replacement therapy before 2002 when the Women's Health Initiative study came out and messed with everybody's head and really scared a lot of physicians. And then we decreased our hormone replacement therapy treatment drastically. And I think that came at a big detriment for women.
Mhm. I agree.
Um, right. And if you look at all the data, all the pooled large studies, they all support appropriate physician guided hormone replacement depending on your symptoms. So I definitely tell my patients to not be scared of HRT as long as they don't have any contraindications, which we would certainly go over.
Right. It's not the Wild West. You can have it. I agree. You just have to let your physician be part of this. You have to find the right team to be part of supporting you. And I
Absolutely.
think I keep coming back to this question with anybody who is open to HRT. And you mentioned contraindications, and I do agree with that. But for the women who don't have contraindications, is there really anybody that doesn't benefit from it? Like, there's this piece of me that it's like, kind of want to introduce everybody to it.
Absolutely. First of all, I will add to that and say just about every woman would benefit from being on vaginal hormone replacement therapy, vaginal cream or vaginal tablets, because we know that such a huge percentage of women after menopause will get urinary tract infections. There's vaginal dryness. Things kind of shrink down there. Our blood vessels become very delicate. The lining of the vagina becomes really thin. And vaginal estrogen is not absorbed into the system. Even women who've had breast cancer can safely take vaginal estrogen. Systemic estrogen is another story, but I don't think there's any reason for any woman to not take vaginal hormone replacement therapy. For
Oh,
sure.
interesting. Yes. Okay. I've listened to a lot of these talks and I've not heard that stated this way. So very interesting. Thank you.
Mhm.
Yeah. So don't be scared of it, I guess, is our takeaway today. Do your research and know that most every woman could benefit somewhere with the right conversation and guided by the right professional. Does that sum
Absolutely.
that up pretty well? Okay.
Absolutely.
Oh, I should ask you this too. Like, do you feel like if hormones play a role in weight management, like if we don't talk hormones, I just feel like for the person who's frustrated, stagnant, I know you started to cover this, but like, do you have a belief system that somebody can still hit optimal weight management goals and not address hormones?
That's a good question. And it's a slightly complex one. In terms of
Hmm.
menopause, we know that there are many things playing a role. Androgens play a role, right? Your testosterone levels drop. We know that your estrogen plays a huge role, so estrogen levels drop. We know that there may be a role that cortisol plays here, and cortisol contributes to weight gain. What we don't have is clear randomized controlled trials looking at, okay, if your cortisol levels are a certain number postmenopausally, how does that correlate with your risk of gaining weight? So while we have data on estrogen, we also know that hormone replacement therapy is not, I wish it were, but is not a cure for the weight gain, right? It's not that if you gain weight, you start HRT and then you lose the weight. So it's complicated and it's not that simple. I think it is important to pay attention to hormones. I think that menopause is meant to happen, right? This is part of our normal process of aging. And so I work really hard to embrace that. I do think every patient should have an intelligent, thoughtful conversation with their physician about the role of hormones in the treatment. And I think in terms of the direct correlation between weight loss and hormones, the jury's a little bit out on that.
Yeah, no, thank you. Agreed. And definitely seeing that firsthand. And then my brain goes to the whole idea that if we're optimizing because of the hormones and we're less depressed and we're less, it's like a side benefit.
True.
Other things will improve, like workouts and
True.
consistency with food. Yeah.
Good
So,
point. I think you're right. We know that sleep and cortisol and weight are also connected. And
yeah.
we know that when we don't sleep well in menopause, which many women don't because of hot flashes, or maybe not even because of hot flashes, it just interrupts their sleep cycle, that
Mhm.
they're not going to feel rested. Their cortisol levels are going to be high, which is associated with weight gain. So I think you're absolutely right. Even if it's not, if we don't have direct data, we certainly have indirect information that informs us about that.
Yes. Oh, I'm sorry. That was a really loaded question for you. And you just did such a good job. Thank you. Again, just confidence in the area of this needs to be addressed. I know that we're running tight on time, but I do want to, do we have time for a little insulin resistance chat?
Sure.
Okay. Because this is another piece that I think when it gets in somebody's brain, they've heard enough about it that they can definitely let it be like, well, if I am struggling with insulin resistance, then I'm already climbing an uphill battle and there's no hope for me on the weight loss end. So go that
Bless it.
direction and then also go with what you hear.
So the answer is hard for people to hear sometimes. One of the best ways to fight insulin resistance, which is common, a lot of us have, there are medical routes, there's medicinal routes like the GLP-1s that can certainly help. The GLP-1s were originally designed to treat type 2 diabetes, and then we found out that you also have this amazing weight loss benefit. So yes, and it improves insulin resistance. We know that exercise is going to have a direct effect on our insulin resistance and the way insulin works in our body. If I check your blood sugar at 8 o'clock in the morning, and then I put you on a treadmill, and then at 8:30, I recheck your blood sugar, odds are it's going to be lower because when we exercise and we move our body, our muscles take in the blood sugar, right? Much more effectively. Our cells take up our blood sugar much more effectively. And so we know it's really, really challenging, but we really know that I want patients to realize that is it work? Yes, it is work. Is it impossible? Absolutely not. It is absolutely not impossible. It
Right.
is
It
very,
goes back
very
to if
doable.
you like it, if you can have a like of movement, you're already winning in that
Yes,
category. Yeah.
absolutely.
It was interesting. I had a client go on, she had one of the patches, the continuous blood glucose monitors. She went through a program to get it. She's not diabetic or anything, but one of her biggest aha moments with it was take a walk after dinner and holy cow, my blood sugar came down so fast. So exactly what you're stating. And just, it's kind of cool to see some of the, I don't know if we all need to be on one of those, but it for her was a huge motivator on movement to see how that messed with.
Yes. And I
Yeah.
like that you mentioned that because I mentioned that to my patients too. Even if you can't get to the gym 3 hours a week, if you can run out for 15 minutes for a quick walk, a brisk walk after dinner, do it because it just makes a huge difference. Huge difference.
Yes, and I think the more we can see our insides through lab work, through maybe not all the time, but a monitor, or just to give us another boost of like things are working even if the scale's not moving, even if,
Exactly.
yeah.
Very,
Hmm.
technology is a huge, powerful tool for us. And I think it works as a great motivator.
Yeah, I agree. And I think it's underutilized. Back to your point of people are used to the BMI or their waist ratio or the scale. And it's like, man, we gotta retrain everybody's brains little by little by. We'll get there. But yes,
Absolutely
what
right.
am I not asking you that I should be asking?
Oh my gosh, we had such a great conversation. There's so much to talk about there. Again, I'm really pushing for our listeners to really remove themselves from shame. I'm inviting our listeners to really explore ways in which they can enjoy exercise in small ways. I love this big yoga movement. I love this movement of Asian Pilates and slower movement, even like Tai Chi. I'm really pushing my patients who say, look, my knees hurt. I can't run. I can't walk. I can't do Zumba. I can't lift weights, to really think outside the box when it comes to taking time to exercise. And I want to invite people to really do that. The amount of the social media, the TikTok videos, the access that we now have to new and creative kinds of way to move our bodies is just unprecedented. And so it's a great opportunity for us to take advantage of that.
That's so good. I totally agree. And I do want to take a second to pick your brain on this because talk about overwhelm and the things that are overly talked about, or we think we got something down and then we hear something else. One of the things that I've really noticed, and maybe it's just popping up on my feed, but is this importance of in the perimenopause, menopausal phase of resistance training, which is really important, but sometimes it takes it like so much to the point that it makes us feel like walking doesn't matter as much anymore, or the yoga doesn't matter as much, that we really just need to be focusing on this resistance training. So if somebody's brain is starting to get like clogged with, oh, now that's all I'm supposed to do, where would you take them down this path of what you've seen from labs, from knees, joints, all of that with any form of movement?
Absolutely. That's a great question. And I think I really try to personalize it for my patients. It is not reasonable to ask my patient who's just had a year ago has had shoulder surgery and their other shoulder is painful to them to say, I think it's time to go to the gym and do some weights. I think weights can be really helpful for a lot of people, and they can be harmful, and they can be difficult, and they can be discouraging for a lot of people. And so the key really is, and again, it goes back to that projector that plays in the back of our head that tells us, well, there's this one way to do this exercise, and this is the way it really should be done. And that's why social media works so well. It's the advertising and those images that we constantly have. And so I really say, yes, studies do show that if you do weights, that it can help with your bone health. But studies also show that cardiovascularly, just walking can also help with your bone health. And so I really try to come up with a personalized exercise plan for each of my patients, depending on their preferences, their personality type, their health complications. If you've got a lot of joint problems or Ehlers-Danlos or hypermobility syndrome or collagen deficiencies or other issues or rheumatoid arthritis, there are certain things you can't do, and that is perfectly fine.
Yes. Oh, hear this loud and clear, listeners. There is an individualized prescription plan for you. Eyes on your own paper is what we always say in my community, and this is just such an example of that. Like,
There you go.
no comparison. Okay, I know people are loving you, Sarah, and I just feel like where is the best place if somebody wants more of you, more of your insight? Where do you like to send people?
Absolutely. I invite you to go to our website. We're at Northern Virginia Family Practice. We have an Arlington clinic in Northern Virginia, and we have a Washington, D.C. clinic where I work. I invite you to take a look at the website. We have some information on there. We do talks in the evening. We do town halls on different topics, and we want everybody to join and take a listen. So I think education and empowerment are really the keys.
I totally agree. And it's being that fly on the wall that I love the idea of showing up to more of your talks that you can just sit there and gather and see what pertains to us individually. So I highly encourage that. And do you do any virtual one-on-ones or is it, yeah, you do.
Yeah, absolutely. We do virtuals as well. We use
Yeah.
telemedicine. Yeah.
Yeah, telemedicine. So I just, again, for our listeners going, I love this person. Do I have to jump on an airplane to go get to him? No, you do not. You can. But yes, thank you for all of your time and wisdom today. You are fabulous.
Thank you so much.